My name's Nick York. I am a CLL patient, a leukemia patient, and I am the chair of the steering committee of the CLL Advocates Network. The CLL Advocates Network is the global network of patient communities supporting those living with a diagnosis of chronic lymphocytic leukemia. It's important to raise awareness of leukemia. First of all, we need to consider that 18% or around 80% of all cancers are blood cancers, and leukemias make up the largest part of this group, or one of the largest parts of this group. And also, a significant number of leukemias are acute conditions, and acute conditions need early diagnosis. They need early recognition of the symptoms, and if not recognized early and treated earlier, then outcomes can be very poor. So it's important that those in the population, that's the general population, in general understand what signs and symptoms are, so that if they experience them, they do present to their doctors in a timely manner. But it's also equally important that we raise awareness in the clinical community, in primary care, so that when people present with these symptoms, and so to make them aware of these symptoms, so that should people present with these symptoms, that they are also able to recognize and help with improving the outcomes for this patient group. I think with day-to-day life, knowledge is essentially power, and it's especially important when it comes to health. So if you're experiencing signs and symptoms that are unusual, then you should make sure that you actually present to your doctor and explain this and not sit on these symptoms. And if you're aware possibly what these signs and symptoms may mean, then that might encourage you to take action. And if you have a condition that is diagnosed earlier, then being able to, that will facilitate you being able to receive the appropriate information and care to then help you react appropriately and live appropriately and employ strategies and knowledge that will help you improve your own health, your quality of life, and the outcome should you be diagnosed with the condition. I think we can make a difference by raising awareness, by actively involving everybody who we are connected to through our networks, or as advocate groups, or as just people, to share knowledge, to share the information about the signs and symptoms, the risk factors, especially during the current pandemic, so that people do make the effort, if they can, to connect with their doctors. So what I would say to everybody is anybody you're connected with, if you have the materials, or if you've been sent the materials, please share them with at least one or two other people. And if you're a part of a network, or if you're a member organization, share it with your members. So really the way you can help most is pass the message on. The more people that understand the signs and symptoms and are aware of these conditions, the more people will survive. And if it's not a immediately life-threatening condition, but life-limiting, the more people will live a better quality of life. Ultimately, early diagnosis improves outcomes. The more people who know about the signs and symptoms and the risk factors, then the more people will have improved outcomes and live better lives.